Go ahead,
Right,
Marilee.
awesome. All right. Thank you so much, Kara and Kathy. Uh, can you hear me okay?
Yes, we can hear you.
Thank you so much. All right. So I am one of the trainers with Conduent. I have been primarily doing provider training, and some of you may have attended training or interacted with me previously. We do have another provider trainer who's coming on board who's going to be taking over some of those duties, and her name is Laura Pierce. So for anybody who's not aware of this, I'm with Conduent. We do provide provider training on a pretty regular basis. We do WebExes once a month, and that's live instructor-led training. We do in-person trainings at various points around the state, including in Anchorage. And you can see the schedule for that on the training page on MedicaidAlaska.com. And anybody that, I'm not going to do a whole big commercial for the training, but just be aware that it is there. If you have questions about it, please feel free to communicate with me, and I'll be glad to kind of give you the tour of what's available. But for today, we are going to go through our materials for early and periodic screening, diagnosis, and treatment. And what we're going to talk about in this session is a program description. We will talk about the providers who are eligible to provide services in this category. We will talk about member eligibility. So we'll talk about the members that are covered for well child services, and we'll also talk about briefly about ways to check eligibility. And this is an important topic because really one of the primary reasons why claims get denied across the board for providers is because the members really didn't have Medicaid coverage. So understanding what that looks like and understanding how to know whether a person's eligible or not is a really important step for anybody that's billing for services on how to be aware of that. So we'll talk about what services are covered under this program. We'll talk about EPSDT transportation, and we'll talk about billing for EPSDT services. So as I'm going, if you have questions or if you want to comment on anything I'm talking about, please throw it out there. All right, so EPSDT stands for Early and Periodic Screening, Diagnosis, and Treatment Services. The goal of this program, which is also known as the Alaska Well Child Program, probably the easier way to refer to it as the Well Child Program, is to ensure that all Medicaid and Denali Kid Care eligible children receive health care they need when they need it. The program's focus is on promoting physical, mental, social, emotional, and behavioral health for all eligible children and to give kids that good, healthy start. Services are available to all Medicaid and Denali Kid Care eligible children under 21. So what do these terms mean when we say early periodic screening, diagnosis, and treatment? So some of you may be familiar with the text block we're looking at here. This is actually taken from the page on the state's website, and we'll see that page and the link to it a little bit later in the presentation. But briefly, early is that children should receive quality health care beginning at birth and continuing throughout their childhood and adolescence. And that care should identify, diagnose, and treat medical conditions starting as early as possible because, of course, we all know the sooner you start to treat a condition, the more optimal the outcomes are going to be. Periodic, the periodic well, child, and dental visits should be received by children at the intervals that are recommended in the treatment plan or the well child checkup. Bright Futures schedule, and we'll look at that, periodicity schedule. Screening, children should be screened for health, developmental, and behavioral concerns, and those services should include health history, developmental and behavioral screening and assessments, physical exams, immunizations, lab tests, screenings for all of the available services. And again, the periodicity schedule lays out pretty clearly when they should be getting what exams and what's going to be necessary at what ages. Another important point, and many of you that look at the state's posts and various communications know that lead screening is something that's been particularly being stressed recently, and this is an important factor. So children should be getting screened for blood lead levels at ages 12 and 24 months. Diagnostic, children should receive further evaluation of health, development, or social emotional problems that are identified during well child visits that may require treatment. So not only should those screenings be happening, but when there's anything identified, the diagnosis should be made, and then they should be getting referred for treatment as soon as possible on anything that's identified. All right, so EPSDT is a federally mandated child health component of Medicaid. The Centers for Medicare and Medicaid Services measure our state's participation in this program by using the procedure codes and diagnosis codes, and they publish the findings for this program for the nation and each state annually. EPSDT findings can be found at the web address that's listed here. So this presentation is in your handouts. It is also posted on MedicaidAlaska.com, and that is a live link at that point, but you can also just follow the link. So for that purpose, it's very important that when you're providing the screening services that you use the codes found on the fee schedule. And we'll look at the fee schedule and where you can find that later, but just please do make sure you're coding it appropriately so that we can report all of the services that are actually being delivered. Alaska Medicaid reimburses enrolled providers for medically necessary services for eligible members when they're delivered, ordered, or prescribed by providers within scope of their license or their certification. Prescribing, ordering, and referring providers, just like service providers, do need to be enrolled with Alaska Medicaid as a provider. So they do need to be enrolled that way as well. All right, so this, as I mentioned, this is the page where you will find EPSDT program information on the state's website, and the link to that is right down here. So it's on the Department of Health and Social Services page under Division of Healthcare Services on the EPSDT page. So there's the link to it. Many of you may already be familiar with that link. And this page also has other good resources along with a link to the travel information that we'll be talking about later and some other helpful tools. All right, so the next thing we're going to talk about is providers that are eligible to provide services under this category. So physicians, advanced nurse practitioners, physician assistants, or other licensed or certified healthcare practitioners under physician supervision, the Alaska Division of Public Health, Indian Health Service or tribal clinics, federally qualified health centers and rural health clinics, municipal health departments, and school districts can all be reimbursed for providing well-child screenings and related services within, as always, within scope of their license or certification. But again, as always, do need to be enrolled as an Alaska Medicaid provider for Medicaid to reimburse for those services. All right, so, and I should also point out that there's an EPSDT billing manual posted on our website. So if you have questions about this, you can also look that information up there as well as on the fee schedule. All right, so as I mentioned, member eligibility is a key point. So these are the eligibility codes that are covered for well-child screenings. This grid is taken right out of the Section 1 of the EPSDT Services Manual. And if you have questions about these eligibility codes or categories or what that means, I would point you toward the best resource that you can publicly access on this topic is the member handbook. That is posted out on the Department of Health and Social Services website. There is a link to it on the member tab from MedicaidAlaska.com. Or you may actually have copies of this handbook. So the older version of the handbook, the eligibility codes listing was on page 29. On the newer version, it's page 40. And that page in the handbook will give you these eligibility codes that you will see on a person's card or coupon, the category of service that means, and then you'll also see additional information as to what categories of service generally a person with that code would be covered for. So medical, dental, hospital, transportation, waiver, those are all columns on that grid. So member handbook, again, is where you can find more information about this. But in short, these are the categories of eligibility that a person can access these services. So it's important that you are making sure you're checking eligibility for your members. So these are, very briefly, these are the methods you can use to check member eligibility. They all have their own pluses and minuses. so you can use whatever combination of these methods works out best for your practice or your business. But please do make a practice of checking eligibility. It will help you be more efficient in knowing where there's going to be coverage and where there isn't, and in communicating that with your patients. So the first method you can use is looking at the member's card or coupon, and always make photocopies of those cards for your records. For adults, Medicaid cards are not necessarily going to show the most current month of eligibility because the cards are issued for a while, whereas for adults, eligibility is a month at a time. For children, eligibility does go for a year at a time. So the dates on children's cards should be okay. Another method you can use is to call the automated voice response system, and this is an automated phone line. It is a toll-free number that you see here. To get into that, you will need an account with Health Enterprise, which you can set up as you enroll, or if you already are enrolled, you can set up a new account with that. So you are going to need your provider identification number, your PIN, as well as your provider ID number. So you will need that to log in because, of course, you're accessing PHI. You can get your PIN update from the organization administrator in your organization. So whoever is responsible for assigning enterprise accounts and maintaining those things would also have your account with the automated phone line. You can log in on Health Enterprise. You would get there on MedicaidAlaska.com. So again, as long as you have an account, you can log in there. On the Member tab, you would just click Member Check Eligibility, and that's really the only option on the Member tab. You can enter your patient's information in there, and you will see their current eligibility, as well as a lot of details with any other insurance they may have, and a lot of other information about their eligibility. So that is a great tool to use, and it's also available 24/7, like most online things. So if you're not already using that method, I would really recommend checking it out. There is an eligibility fax form. This is posted on MedicaidAlaska.com on our forms page. You would fax it to the number given there, which is also on the form itself. So you would enter the ID number or Social Security number and the name for the patient you want to provide services to, and then the month and year that you're going to be rendering services. One downside with the form is that is not going to be an immediate response. If you're calling in, if you're checking the card, if you're checking online, you can find that out pretty immediately. The fax form, they will take about 3 days to get that back to you. So if you have a patient standing in front of you, that is probably not your method to use, but it is something that you can if you have some lead time. Also, if you are using practice management software that has an eligibility inquiry transaction, you can send that in and receive a response. Those likewise are not real time. Those are batch processed, so that's an overnight turnaround. And then finally, you can call provider inquiry. So provider inquiry is here in our office in Anchorage. They are available Monday through Friday, 8 a.m. to 5 p.m., except for Fridays. They have a team meeting 8 to 9, so about 9 to 5 on Fridays. So you can get hold of them as well, and they can give you eligibility information, as well as answer any other questions you may have about claims or services or that sort of thing. So that very briefly is your methods for checking eligibility. We do have an eligibility class that we teach every time we do a training. So if you would like to find out more about eligibility and how it works and some of the details of checking, that is something that you can access. The presentation's posted on the training page, or you can attend any one of the trainings that are coming up. All right, so looking at EPSDT services or well child services. So what is covered as a well child service is listed on the fee schedule. And here we see one of the 2 pages for the EPSDT fee schedule. So on the top part here, I know this is a little bit tiny, but I'd encourage you, if you are not familiar with the fee schedules, to go ahead and take a look at those. Those are on MedicaidAlaska.com. You would get there under Documentation, Documents and Forms, and then Fee Schedules, and then look for the EPSDT heading and the newest one. So the covered procedure code and description, maximum allowable reimbursement, and then these are the applicable diagnosis codes to use with the procedure codes that are documented there. All right. Well-child screenings do not require a service authorization. However, if as a result of an EPSDT screening, you need to refer a child for further treatment, that treatment may or may not require a service authorization, and that is going to be based on the service itself. So whoever is going to be providing the recommended service, if it's a physician or a vision provider or a hearing provider or whatever the case may be, they would look at that fee schedule to make the determination about that recommended service. All right, at a minimum, an EPSDT screening needs to consist of a comprehensive medical screening, including a health and developmental history, any anticipatory guidance that you feel is needed, and then the following screenings at age-appropriate intervals or as indicated in the periodicity schedule. So dental, developmental behavioral screenings and assessments, hearing screening, vision screening, again at 12 and 24 months, lead screening is required, and then any other tests or procedures that are age-appropriate and medically necessary for that patient. EPSDT screening should comply with the minimum recommendations of the Bright Futures American Academy of Pediatrics recommendations for preventive pediatric care periodicity schedule, except for the lead screenings, and again, that's 12 and 24 months. As I mentioned already, and I know I'm kind of leaning on this, but it's an important point. When screening indicates the need for further evaluation, the screener does need to, if they can, provide follow-up care within scope of their license, or if that's not something they're going to be able to do, they need to refer the patient to another enrolled provider for follow-up care without delay. All right, so I've mentioned the Bright Futures periodicity schedule a couple times. You can find their information on the Bright Futures website, brightfutures.aap.org. Links to this are, I believe, on the state's EPSDT page, also, of course, here in the presentation. So there's materials and tools for providers, for families, and lots of good, helpful information. And the periodicity schedule is posted right here, and we'll have a look at that briefly as well. So this is the periodicity schedule. I know it's very tiny here. I recommend that you, if you're not already familiar with this, and I suspect most providers are, please do go to that website and take a look at this, because this you can download for free. So what this does is this gives you a listing of all the various screenings and tests and things that may need to be performed, and then gives you the ages when those things need to be performed, or risk assessments should be performed, or when those things need to happen. All right, comprehensive medical screening or well-child checkup needs to include, as always, health and developmental history, comprehensive unclosed physical exam, and all age-appropriate screenings and tests. Providers should be documenting their assessments and any significant findings in the member's medical records, discussing findings with the child and their family, and if the provider is not going to be able to perform any components of the screening, they do need to refer that member to another enrolled provider to complete that process. During the screening, if there's any necessary or required blood panels, screenings, specimen collection, anything like that that needs to happen for that particular screening, the screener should make sure that they take care of that during the exam. Oral health screenings should begin at 6 months for a child. At age 3, a child who is not already under a dentist's care does need to be referred for a dental examination. So dentists and dental health aides can perform dental fluoride applications and oral evaluations, but also physicians, advanced nurse practitioners, physicians' assistants, and community health aides and practitioners can also perform those services if they have completed an oral health or caries risk assessment training program and have a certificate of completion in their records. Alaska Medicaid covers a maximum of 4 fluoride varnish applications per calendar year. Oral evaluations are limited to 1 a year for children 3 through 21 and 2 a year for children, eligible children under age 3. As always, this is for kids that are covered by Medicaid, so that's what the eligible is pointing to. Developmental screenings and assessments, minimum recommendations for developmental screenings and surveillance. Standardized developmental screenings should be administered at the 9 months, 18 months, and 30 month visits. Autism screenings should be administered at the 18 and 24-month visits. Developmental surveillance is a cumulative and continuous process that should be performed at every preventive visit throughout childhood and adolescence. In all cases, additional screening should be performed when surveillance demonstrates risk or when any concerns arise during surveillance. Any concerns should be referred to your local early interventions, Alaska Infant Learning Program, or other appropriate healthcare providers. And to the autism screening, for anybody that's not familiar with this, Autism Services is a new category of service that is being covered. So there's a new manual out there, a new fee schedule. So if you are involved in autism services or have patients or clients that you feel might benefit from that, that is something to also take a look at. The Department of Health and Social Services recommends use of these validated standardized screening tools for 2 months to 5 years, the Ages and Stages Questionnaire, or Ages and Stages Questionnaire 3rd edition. For birth to 95 months, a Battelle Developmental Inventory Screening. For 3 months to 2 years, Bailey Infant Neurodevelopmental Screen. For birth to 90 months, Brigant Screens 2. For 18 months to 6 years, Child Development Inventory. For birth to 18 months, the Infant Development Inventory. For birth to 8 years, Parents' Evaluation of Developmental Status, and then also using developmental milestones. Screening tools can be completed by the child's parent or guardian or healthcare staff, but do need to be reviewed by either a physician, A&P, or PA, and this is as appropriate for the type of screening. Physical or occupational therapist, speech-language pathologist, audiologist, psychologist or psychological associate, community health aide level 3 or 4, EPSDT screener, or a public health nurse. And coverage of screening services is limited to 2 screenings per visit. So for the actual service providers who are evaluating those tools, they can claim up to 2 screenings per visit on their billing. For hearing screenings, providers should perform hearing screenings to their level of training or refer members to another Alaska Medicaid enrolled provider who can provide those screenings. If medically necessary, audiology services should be ordered or prescribed. And please do be aware that Alaska Medicaid does cover hearing aids as well as repairs and replacements for hearing aids. And a little bit later, we're going to go into a very brief overview of the types of services that can be covered for children if there's need based on their medical necessity and on their screenings. EPSDT screeners should perform vision screenings to their level of training or refer the member, as always, refer the member to another enrolled provider who can complete that screening. If screening results indicate a need for treatment of a defect, refer the child to a vision care provider. The Department of Health and Social Services has more information and resources concerning lead exposure and screenings available at the link given here, so lead-free. The Alaska Lead Surveillance Program in the section of epidemiology is also available by phone, and their number is given there, so 907-269-8000. Screening and Brief Intervention Services, also known as SBIRT or Screening, Brief Intervention, and Referral to Treatment, is a 3-part approach to drug and substance abuse intervention. Use of this protocol or these services can decrease the frequency and severity of drug and alcohol use, reduce the risk of trauma, and increase the probability that patients who need specialized substance abuse treatment will receive it. So, alcohol and drug use screening should be incorporated into the well child screenings starting when children are at age 11, when surveillance indicates risk, or when any concerns arise during surveillance. SAMHSA, the Substance Abuse and Mental Health Services Association, provides screening instruments and tools for providers, and they are at samhsa.gov, so you can get those tools there and get more guidance on this process. When a well child screening indicates the need for further evaluation, healthcare providers performing the screening must, without delay, either, and I'm going to take these backwards from the points here, provide follow-up care within scope of their license. So if they can take care of the service right away, please do. Or alternately, refer the member to an enrolled provider for follow-up care. Alaska Medicaid covers all referrals and follow-up care made during the EPSDT screening for a medical need. Alaska Medicaid covers medically necessary diagnostic services and treatment of physical and mental illnesses and conditions discovered by any screening and diagnostic procedure. Some of those, as I mentioned this before, some of those services and treatments that are follow-ups may require a service authorization, although the screenings will not. So the service provider needs to look at their fee schedule to determine whether they need an authorization for the service they're going to provide. So that the screenings happen without a service auth, but when the child's referred on for further treatment of anything that's identified, then the services go by the fee schedule for that service provider. All right, so as I mentioned, we're looking at the services that are available to eligible children in the different categories of services. So under audiology, testing and treatment by an audiologist is covered. Hearing aids, batteries, repairs, and a number of other types of audiology-related services are covered. Under behavioral health, brief intervention services, or ESPER, we looked at a little earlier. Also behavioral health assessments, evaluations, and treatment provided by psychiatrists. Mental health physician clinics, community behavioral health clinics are covered. Under chiropractic services, spinal manipulations and x-rays are covered. For children under 6, those services are going to require a service authorization, but not generally for children older than 6. In the dental category, children's services are actually pretty extensive and include exams, x-rays, cleanings, fluoride treatments, sealants, fillings, surgical and restorative services, and limited orthodontia. Under developmental assessments, these are covered when provided by a certified infant learning program, school district, physician, advanced nurse practitioner, or public health nurse. Family planning services include medical services, prescription birth control supplies, and over-the-counter birth control supplies with a prescription from the teen's medical provider. Hospital services include most things, lab tests, x-rays ordered by a healthcare provider, emergency room and outpatient surgery, and hospital services may require authorization by a physician. Immunization includes administration of medically necessary immunizations and vaccines. Under medical equipment and supplies, for DME, any type of durable medical equipment or supplies, some things are going to need to be authorized. These things are requested on a certificate of medical necessity, starting with the healthcare provider, going on to the DME or service supplier, and then they would submit that. Nutrition services are available to nutritionally at-risk children and pregnant or breastfeeding teens. Those services are available from registered dietitians or nutritionists with referrals from WIC or a physician, AMP or PA. And what's available there is an evaluation by the dietitian or nutritionist, and then nutritional counseling. Physical therapy and occupational therapy are covered, and that will include the evaluation and treatment. Podiatrists can provide ankle and foot services. Pregnancy care includes regular prenatal care and hospital delivery services and costs. Prescription medication that's offered by Alaska Medicaid includes comprehensive drug coverage. There's a pharmacy billing manual and a pharmacy page on the state's website on the Department of Healthcare Services page. Division of Healthcare Services page, and there's information about what's covered there. Private duty nursing services can be covered for a purpose of preventing readmission to or assisting with early discharge from an acute care or long-term care facility. Speech therapy services include testing and treatment by a speech therapist. Substance abuse evaluation and treatment can be provided at state-approved programs. And then under vision care, services that are covered include vision exams, treatment, therapy, and also eyeglasses. For eyeglasses, the frame choice is limited. The eyeglass provider for the state is Rochester Optical, so what's available from them on their Medicaid service list is what can be provided. So that's a very broad overview. For more specific details, the fee schedules and billing manuals for these other enrollable provider types is what you would want to look at the specific details. All right, so as I mentioned, immunizations and vaccines are covered. Under age 19, Division of Public Health provides most of the immunization products to providers throughout the state at no cost. When a vaccine product is provided by the state, Alaska Medicaid does not reimburse providers for those products themselves because, of course, they're already available for free, but will pay for administration of those vaccines. Alaska Medicaid covers the administration of medically necessary immunizations for members under 19 that are provided by a physician, PA, or AMP, and when Board of Pharmacy has approved pharmacists to exercise collaborative practice authority, then there as well. Providers can bill Alaska Medicaid for provision and administration of immunization products that are unavailable through the Division of Public Health. For children 19 and older, Alaska Medicaid does cover the vaccine and administration of the immunizations listed here when they're medically necessary and administered by an enrolled eligible provider. So that would include hepatitis A and B, herpes zoster or shingles, human papillomavirus, MMR, measles, mumps, and rubella, and meningococcal. Also pneumococcal, rabies, seasonal influenza, tetanus diphtheria, tetanus toxoid, reduced diphtheria toxoid, and axillar pertussis, and varicella or chickenpox. All right, so that's the covered services. Any questions about any of that at all? Okay. I'm sorry.
This is Kara. Sorry.
No, that's okay.
You can write your questions in on the question panel there, and sometimes it takes a little bit for questions to get, put in. But go ahead and carry on. I know folks that there were just a couple there. But write them in as you think of them, and you can certainly go ahead to your next segment, and then we'll just go back and catch up. Okay?
Okay. Fair enough. Thank you. All right. So the next thing to talk about is EPSDT or well-child transportation. So many of you are already probably aware that Medicaid does do transportation both within a person's community and also outside of their community when they need to travel for medically necessary services. This is a slightly different program than that. It's administered differently. It has an overlapping but slightly different coverage area. So in the well-child transportation program, children under 21 and pregnant women who are currently covered by Medicaid or Denali Kid Care can receive local transportation assistance to and from EPSDT-related medical, dental, and WIC appointments. So that's one thing that's a little bit different. Regular Medicaid travel does not cover WIC appointments, whereas well-child transportation does. The transportation assistance available through this program includes taxi rides and bus passes, which regular Medicaid travel also covers, but well-child transportation also covers gas reimbursement, which Medicaid travel will not, so that's a slightly different thing as well. Another thing that's different, regular Medicaid transportation needs to be requested by a medical provider. EPSDT transportation can also be requested by the member or their parent, so that is something very different as well. So to request travel in this program, you can either email the email listed here, you can phone one of these numbers, there's also a fax line. They do need a business day advance notice to facilitate most transportation requests, and I believe if you are requesting a bus pass to be mailed to you, that is going to be a little bit more of a lead time. Their business hours are Monday through Friday, 8 a.m. to 4 p.m., and there's a flyer available either by following this link, or there's also a link to it on MedicaidAlaska.com if you're on the members page. So there's a link in the transportation resources right out to that program. So that is a nifty thing that both members and providers can avail themselves of for transportation. And again, this is only within communities. This program is not going to pay for flights or accommodations or anything like that. This is within communities. Medicaid does cover, as I mentioned, out-of-area transportation and accommodation services and some local transportation when travel is required to receive non-emergent medically necessary services. Pardon me. When you are going to be traveling somebody for this type of transportation, both the referring and the receiving provider do need to be enrolled with Alaska Medicaid, and the services that the member is traveling to receive must be covered by Alaska Medicaid.
And Marilee, can I add a couple things? This is Kathy.
Yes, please do. Thank you.
Yes. First of all, when requesting the Well Child Transportation Program, I would really encourage people to call the number rather than use the email. The number, for sure, someone's going to look at in a timely manner. And the email, if that person who usually does that job is out sick or something, that might not happen with the email. So I'd really encourage calling the number. And secondly, just to be clear, for instance, for gasoline reimbursement, we might have people driving from Soldotna to Anchorage and back or something, and they can get reimbursed for that, even though they're outside of their community. It's just not covering flights and accommodations and meals and that kind of thing.
Yeah, thank you. That is an excellent point. All right, thank you. That is good clarification. Okay. All right. So use the phone number. It does cover out of area if you're driving. So that's all good to remember. All right. So billing for EPSDT services. Claims for developmental screenings and assessments need to be submitted with the CPT code listed here. This is also in your fee schedule, but it's kind of a good reminder that that's the code that would need to be used. And again, and I know I mentioned this before, coverage is limited to 2 screenings per visit. If you are using one of the Alaska Department of Health and Social Services recommended standardized developmental screening tools, use modifier 33 with the CPT code 96110. Don't use modifier 33 when billing for domain or disorder-specific screening instruments, such as the MCHAT. Claims containing CPT code 96110 that are billed on the same date of service as CPT code 96111 will be denied. So those two things are going to be mutually exclusive. So do have that in mind. The appropriate 993 or 994 CPT codes should be used to bill for comprehensive preventative exams, meeting the EPSDT components and requirements. See the EPSDT fee schedule for a complete list of the covered codes. And again, and I really do have to stress this, please use those codes on the EPSDT fee schedule to make sure that things are getting tallied appropriately and counted appropriately. Some 992 CPT codes may be covered as an EPSDT-related service if the child is being seen for other than EPSDT-related reasons, but receives a comprehensive preventive exam that meets the EPSDT requirements. These procedure codes do need to be billed with an applicable diagnosis code to qualify as an EPSDT service. And again, remember those diagnosis codes are also on the fee schedule. And I, again, have to remind you that CMS, or Centers for Medicare and Medicaid Services, is measuring our state's participation in this program, and they're looking at those procedure codes and diagnosis codes that are on the fee schedule. So please do make sure that you're using those codes. All right, pricing methodology is resource is based on whatever is appropriate for that provider type. Some providers' services are paid based on the RB-RVS calculation or resource-based relative value scale. Some codes are paid at 100% of the RB-RVS methodology, regardless of the provider rendering the service. And you can look at that EPSDT fee schedule to determine which codes are paid at that rate. Pricing for services without an established relative value unit, or RVU, are manually priced by the department. And the fee schedule lists the maximum allowable reimbursement rate for covered preventive services and for evaluation and management services. All of the covered EPSDT-related services and reimbursement rates are in the applicable provider type fee schedule. These services are billed using the professional format because they're going to be provided by providers in the professional category by and large. So you would bill either using the CMS 1500 paper claim form if you're billing on paper. If you're billing using practice management software, you would use the 837P transaction type. And if you're billing using either of the portals, either Health Enterprise or PayerPath, make sure you're submitting using the professional format. Make sure that you're checking the EPSDT indicator. So that's what these little images are at the top here. So if you're using the paper claim form, column H on each line item for the billed services gives you an opportunity to indicate that you're providing EPSDT services. And if you're billing electronically, that will be a little checkbox. Use the appropriate reason code found in the NUCC manual to represent the EPSDT-related service in Field H on the CMS claim form, or check the box when you're submitting through Enterprise or any other electronic submission method. So, resources that I've been talking about are available on MedicaidAlaska.com. There's also a lot of good resources available out on the state's website. If you have questions, you can call Provider Inquiry at the numbers given here, so 907-644-6800 or 800-770-5650. MedicaidAlaska.com will take you to the EPSDT fee schedule and billing manual. It will also take you to the member tab, where you'll find a link to the member handbook, and also to a link to the flyer for the EPSDT travel services, as well as a number of other types of resources. All right, so that is what I have for the presentation. Any questions or anything that anybody has?
This is Kara. What are your thoughts? What would you like to ask? Go ahead and type it into our question area. There was one question that said, what would a school district bill under EPSDT? And the answer is speech and OT provided by the school.
Right. Yes. And if you are an enrolled school district, there is a school billing manual, school services billing manual, and a fee schedule that's out there for you. So if you're an enrolled school district, that is a category of service. Mm-hmm. So the referred services would be listed there.
Right, and there is also a fee schedule for school-based services that people can look at.
So our staff here mostly are involved with our waiver programs and our long-term services and supports. What are your questions about what you saw that EPSDT covers and our services that we know about? Says, what's the most important thing that you want SDS staff to know about EPSDT-related autism services? I think that I think it's two separate things. EPSDT is different than autism services, but if you want to go ahead and have at that one, Marilee and Kathy.
But yeah, this is Kathy, and I would say that autism services can be included within EPSDT and is part of the screening, and of course we want the kids to get referred if possible. It's kind of things with autism are changing pretty rapidly, so that becomes maybe an issue. People have a lot of questions about that, but when it comes to autism services, I mean, part of what we want to do, and one of the main focuses of EPSDT, is to screen kids so we know what kind of help they will need for whatever it might be. So it's more of a preventative services type of thing, and then get them to their help. So, maybe they would get referred to some programs that SDS is involved in once they're diagnosed.
Yes. And to kind of add there, this is Marilee. So a child would be screened for autism signs under the EPSDT program, referred out to an EPSDT provider, who would then do their further evaluation and provide any services that are going to be helpful or necessary for that child. So I'm going to show my screen very quickly, just not to hijack the whole thing, but just to show you very briefly where you can find the resources that I've been talking about on MedicaidAlaska.com. So this is the home screen. I think, is everybody seeing this?
Yes. Yes.
Oh, okay, thank you. So if you go to documentation and forms, fee schedules are available here. The billing manuals are here. So just to look at this briefly, the billing manuals, there's a whole new autism manual. So you can click on this and you can see what autism services would be available should the child have medical necessity. So the whole process starts with the screener. If the screener sees any indicators, they can refer the child out for treatment. And then the services can be provided as needed by enrolled providers. So you'd be able to get to the autism services here, so treatment plans, service documentation, all the information that's going to be covered there. And then the fee schedules will show you the exact specific covered services. So if you go to fee schedules, accept, and I think that's going to be under Department of Behavioral Health fee schedule, so that would be out on the state's website as far as autism services. So let me find that very quickly. And I know I just scrolled past that, so okay, Division of Behavioral Health. So this goes out to the state's page, and then the services that would be covered would be on the fee schedule here. So here's the autism services Medicaid procedure codes. And there's the services, who can render those services, the name of the service, maximum allowable reimbursement, and then the duration of those units. So there you can look at the specifics right there. Back on MedicaidAlaska.com, the EPSDT fee schedule that we showed you, I showed you a very tiny picture of. Here it is, kind of closer. So there's the covered services under EPSDT. There's the diagnosis codes, and then the 993 codes that we were talking about before. The last thing I would like to show you out here, so you know where the manuals are, you know where the fee schedules are. On the member tab, the EPSDT Well Child Program is you can get to it from these transportation resources from this link, and this will take you right out to the state's website, to the page for that service. And as the ladies noted, please make sure you're calling the number and just be aware of these services. And that's also something you can make your clients aware of as well, and they can use that resource. It doesn't have to be medical providers that are doing that. Okay. Thank you. Sorry for that.
Yeah, no, it's great. So if people have questions about autism services under EPSDT, who should they contact? Who should we, SDS, contact? And, you know, people could be staff. It could be people who would potentially receive the services, their family members. Who's good to tell people to contact?
I would say probably provider inquiry can give some basic information. If they want much more in-depth information, Division of Behavioral Health would probably be who to talk to.
Okay. Other thoughts? And I'm just watching our question bar here. Go ahead and type in your question. Or we could even try, if you're on the phone and you have a group or you're just by yourself on the phone, we could probably unmute your audio and you could share over the phone lines. We could try it. If you want to do that, go ahead and raise the little hand. Hit that little hand and I'll give it a try, because we have kind of a limited audience here, so we could probably do that. If you just want to speak your question, we could go for it. And hit that little hand and let me know that that's what you want to do, and I'll unmute your audio. All right, question says, could you show the slide about State of Alaska recommended developmental screening tools again?
I absolutely can. Let me bring that back up quickly. I think that should be it.
So we should be able to, yeah. Go ahead. Go ahead, sorry.
I know that there's no, I'm sorry. I know that there's a resource page out on your website as well. That I'm sure you know the location of better than I do. But.
And this is Kathy, and if anybody wants some of this type of information, I can email it to you. My email address is really easy. It's Kathy, Kathy, .berry, BERRY, @alaska.gov. And I'd be happy to send you some of this type of information.
And we'll have the PowerPoint available too by email. The one that you're looking at here, we'll get a copy of that to you as a handout. I'll just email it to us after the session. Not a problem. What else is on your mind about EPSDAT? If you want to share by audio, go ahead and hit the little hand, and we'll unmute your audio, or just type it in. All right, I'm not seeing questions come in. By a show of hands, we don't have to stay in the session, longer than needed, I don't think. By show of hands, if you are wanting to go ahead and close the session, raise your hand if you're okay with it. Feel like you got the info. Okay, some people are just leaving. That's okay too. I'm fine with all that. Okay, most of us here are stating that they're okay with closing the session. So I will go ahead and lower the hands. I want to thank our presenters for being with us here today and sharing this great information, Marilee Reinhardt-Davio and Kathy Berry. And we have recorded the session, so what I'll do is I'll place it onto our shared drive here at SDS for folks to access at a later date. And people can learn about this topic. All right, so we're okay to close the session. Go ahead and click out when you're comfortable, and we'll close it as soon as we see most people have left. And again, thanks